My name is Katie Burns. I'm a family nurse practitioner at Clarinda Regional Health Center. I received my family nurse practitioner from Clarkson College in Omaha, Nebraska. Prior to that, I worked as a registered nurse for 10 years before going back to school. I've been an employee at Clarinda Regional Health Center since 2011. I've worked in numerous different departments, and doing direct patient care really made me realize that I could help patients in a different way by going back to school, and that was part of the reason I chose to go back and become a nurse practitioner. I chose to go back to become a nurse practitioner because I wanted to be able to help patients in a different way, not only as a nurse providing care for them, but being able to treat a medical issue or help them through a tough time. I want to be able to make a difference in my patients' lives and help them to become better versions of themselves in whatever way that may be. Some of the things I love about my career are when I correctly diagnose a person's problem and help them to no longer suffer from that illness, from that issue, and they tell me, I don't have pain anymore, or I don't struggle with this every day. When you make a difference in someone's life by the things that you're able to prescribe or help them do, the connections that you're able to make with, specialty referrals, those are the things that make me know that what I'm doing is the right thing, because I know I'm making a difference for someone. My husband and I have been married since 2010. We have 3 children. In our free time, we are found at the golf course. We're out there probably 5 or 6 days a week. Both the kids play golf. My son got a hole-in-one when he was 5. We've just really enjoy golf. If I have a free moment by myself, I like to read. I read a ton of books. Can be any sort of genre, or I like to do anything that's going to help me better myself through work, maybe a continuing education. We also have 2 dogs, 2 cats, and a pony, so that keeps us on our toes. I feel like I'm a very down-to-earth, personable person, someone that people can relate to. I try not to be judgmental, because you never know where someone has started from, where they're at in their lives. At some point we may be in the same situation, so just trying to be as open and non-judgmental as possible, I feel like really makes patients feel comfortable, and they're willing to open up, and then you can better assist them to get where they need to be. I actually was born at the old hospital. I've lived here essentially my whole life, except for when I moved to Des Moines to go to college. My family is all from here. Most of my friends are from here. It's one benefit of living in a small town is that you kind of know everyone in one way or another, or there's a connection between yourself and someone. And that's what makes Clarinda Regional Health Center very special, in my opinion, is that you can almost always run into someone that knows someone or knows a parent, a sibling, a friend, and those are the kinds of connections that you want, because then I feel like the care that you provide is even more special, because it's not just some random person off the street. It's, I know you, I know your family, and I feel like patients can really tell that small town feel of medical care versus big city medical care.